Let's talk about how the pre-op process should run in my experience. So say you have already seen me as a consult and you have booked surgery. What happens next? So I'm going to have my patients do minimum one pre-op appointment without me and one pre-op appointment with me. So the pre-op appointment without me is done with your primary doctor ideally. So you're going to go see that doctor, and based off of your age and medical history, you're going to have a series of tests and potentially studies, mammograms, EKG, and they're going to evaluate you and see, hey, is this person safe for a surgical procedure? So again, what labs and studies we order are going to depend on what type of surgery you're having and also your past medical history and age. All of these things are done before your pre-op with me because we want your doctor to check you out, make sure everything is as it should be, and adjust things if needed. So say your EKG is abnormal and we need to get a cardiac clearance. Say your mammogram's abnormal and we need to get a biopsy or additional imaging. We want time to have all that stuff done to make sure that you're safe for surgery. Now, this is typically called a pre-op optimization appointment. So a lot of older doctors will call it a clearance. The younger doctors get feisty about calling it a clearance. But this is what people typically mean when they mean pre-op clearance. It's your optimization appointment. We're going to optimize you for surgery and make sure all systems are go. Now, after you have all of this done and we know that you're ready and optimized for surgery, you're going to do a pre-op appointment with your surgeon, your surgeon's PA, or potentially both. Now, the purpose of that appointment is different. The purpose of that appointment is to not only fill out paperwork in the office, like your consents, but it's also so that we can make sure you're prepared for surgery. You know exactly what's going to happen. You know what the day of surgery is going to be like, where you check in, who needs to be there, how long the procedure is going to be, what the post-op recovery is like, any recommendations for making the recovery easier or better for you. All of that is going to be done at your preoperative appointment. In my practice, that's usually about 2 weeks before surgery. So we want to make sure we got everything in place and that you are ready for surgery. We also usually give you prescriptions for the post-op medications that you'll need at that point. And if there's anything in addition that didn't get done by your primary doctor or something we identify that is a need before surgery, we have plenty of time to take care of it then. Now, the concern is if you don't have a doctor other than your surgeon or your surgeon's little circle in their office doing your pre-op, that they may not make the best decisions for you. You really want an uninvolved doctor who is treating you for one reason, and that's just to see if you're safe and optimized for surgery. And that person's always best if it's your primary doctor who knows you. So like I said, this needs to be done in advance because it takes time to get all of these things done to make sure that you're prepared for surgery, and it's just not enough time if you're doing it right before. And then also to have that extra stress involved of someone flew in from out of the country and they've already paid you for surgery, you worry that the decisions of that surgeon or that physician that's clearing you may not be the best because we want what's safest. We don't want what's convenient. And what's convenient for that patient is to go ahead with surgery, right? It may not be the right thing to do. So that's the concern. There's some people in the comments saying things like, well, they send you a list of labs and you can do that before you come down. Yes, but who's managing what's on those labs? Who's looking at those labs and making medical decisions for you? Because your physician in a foreign country cannot do that if you're in the United States, right? So no, that is not a proper pre-op. Sending you for labs is not a proper pre-op. So, you really need to have someone look at you and evaluate those labs and make decisions for you. And a lot of these patients, like a facelift patient, are typically older patients. They have more medical problems. The Guadalajara patient was a massive weight loss patient. They have a lot of issues with nutrition deficiencies. They need additional testing and to check in to make sure that their systems are all working appropriately. And a day or two is not enough time.